Hello, I'm Matilda Boseley from The Guardian Australia, and let's see if I have COVID. So the TGA has just approved several different types of these COVID-19 rapid antigen at-home tests. And because these are being done at home, they're meant to be, quite user-friendly, quite silly little person-proof. But I, a silly little person, am keen to put that to the test.
The actual testing process is designed to be simple, it's easy to follow, and it is painless. So if you open up your kit, you'll probably find that it's in several different pieces.
Yep. Okay. So tell me what I'm seeing.
You should have a swab.
Okay, we've got one swab.
You should also have a small well with a small amount of solution in it. You should have a small applicator, which is essentially like a tip.
This sort of nipple-ish.
That's the one. And the actual device itself, which looks identical to a pregnancy kit.
It is pregnancy test-like. Not that I would know.
With the swab, take it out of its container, and you are going to very gently insert it a couple of centimeters up your first nostril, far enough that it's comfortable. But if you get your eyes to water ever so slightly and twist for about 5 seconds in the first nostril.
So eyes watering ever so slightly.
And then when you've done it for 5 seconds, twisting and turning, do the same in the other nostril.
Okay. One nostril. No sneeze.
And for another 5 seconds, just twist gently.
All around or just at the top?
You just gently rotate it around and twist between your fingers at the same time for another 5 seconds. So about 10 seconds in total. So then what you're going to do is with the cotton bud down into the solution and just gently twist it so that you're going to try and remove any of the particles on the cotton bud and dissolve it in the solution. And if you want to, you can pinch the bottom of the well, if you like, that the solution's sitting in, so that you can really squeeze out if there's any virus particles in there.
So I'm sort of pinching as I'm twisting and swirling?
Yep, just to try and ensure that you get any particles that are on the swab into the liquid. Then you're going to pull slowly the cotton bud out, but whilst you're pinching. So you're essentially going to squeeze any remaining fluid from the cotton bud back into the well.
Okay, so pinching it as we pull it out and getting all that liquid into the well.
That's it.
Sure. Okay.
Then you can dispose of the cotton bud.
Yep.
And your little, what you described as the nipple, the applicator, put it on top of the well so it creates a seal.
Nipple side out?
Yes, please.
That's what we're meant to be up to?
Perfect.
Okay, amazing.
All right. Now, with your test kit, if you haven't already opened it, obviously open it. And you can see at the bottom of it, you'll see the small square. You can see that it says 3 drops onto that square. 1, 2, 3. Awesome. Now, if you've got good eyesight, you should be able to see that the solution is starting to migrate itself along the rectangle, which is essentially the test strip. On the test strip itself, you'll see that there's 2 letters, a T and a C, a test and a control. So just about now, if your solution has reached as far as the C, you should see a pink line. That's just to suggest that the test is working. Okay, awesome. So now what you need to do is make a note of the time, or if you have a timer, we're going to go for 10 minutes and then we'll come back and have a look to see what we've got. Okay, for the big reveal. Yeah. 1 line. Ta-da! A nice peace of mind. I coughed once earlier today, so it was in the back of my mind that there might have been a problem, but that's nice. It's good to know. I might frame it.